Hi, my name is Dr. Desiree Azizodin, and I'm a scientific advisor here at Nerveli. We've taken our evidence-based science from the lab into your mobile phone app to try and help you better live your day-to-day life with chronic pain. Chronic pain is complex, but your relief shouldn't be. We've taken a bunch of different scientific content and applied it to this mobile health app, where if you just use it for a couple of minutes per day, we have evidence to show it can not only improve your pain, but help you to live better. A lot of treating chronic pain comes from understanding why you have chronic pain, how to cope with it better on a day-to-day basis, how to understand your medications and other treatments better, how to apply them to your life, and basically a lot of trial and error and a lot of tracking. We can help you through that process by learning all of our evidence-based tips and tricks here in the app, tracking everything, and getting our AI-assisted device, Nerveli, who's been trained specifically in chronic pain, to help you with those day-to-day processes. Let me walk you through the app now so you can get a sense of what you can do each day, how you can use the app, and why it might help you. It's quite simple, just bear with me. At this point, you've probably downloaded the app already, and it's had you put in your phone number and your email. This is just so we can keep track of who's downloaded the app on your phone. And that way we won't share your information. Everything is what we call HIPAA compliant, so it's very, very secure, and all of your patient reported data will only stay within our system. Once you download the app and you put in your name, the app will guide you through our basic, what we call baseline questions. So we can get an understanding of what does your life and your pain look like right now at baseline. It only takes a couple of minutes. You fill out those questions, and at the end of those questions, you'll be able to put in your test code. So you may be getting a link to this from one of your doctors, from your healthcare team, or from an employer. Put in that code here, and then we can start the app. Now, once you've done that, say return to app and follow my instructions. Okay, here we go. So you come to Nerveli at the home screen, and you'll see here that you'll be greeted where it says, "Hi Des, nice to meet you, I'm Nerveli." You'll click continue and fill out these questions that will be integrated with our AI model to help understand your pain and really personalize your app treatment experience moving forward. So I've had pain for longer than 3 months. We'll move forward. I want to learn to better manage my pain and get back to the things that matter to me, improve my quality of life. My pain's been pretty bad the last couple of days on average. A reminder to please go to the emergency room or call 911 if you're having significant chest or belly pain that should be evaluated or hasn't been evaluated yet. This is talking about how much pain has interfered with your activities recently, so you'll want to fill those things out. My pain is usually pins sticking and electrical and sharp, so I'll include those qualifiers. I'm in pain weekly. I'll mark that here. I've been to the emergency department once for pain recently. I visited a doctor once for my pain recently. And pain can make us worry a lot about the pain itself or other things in our life. It's totally normal. We want to record that too. So I'll write here that I keep worrying about how much the pain will end a lot. I keep thinking how much it hurts a lot. I'll put in my age, my gender. If you allow us to also integrate data from your smartwatch or fitness tracker, our AI assistant can integrate that to make reporting even easier and give you personalized advice. My pain kind of started gradually. I've noticed that light, sound, and stress make my pain worse, but you can include whatever makes your pain worse here. This will also help us figure out what's going on. This might be something like sitting for too long or walking too much. And maybe what makes it better. I'll put medications and relaxation. I usually feel better when I do that, when I use those tools. Now, we'll take all of the content that you told us into our algorithm and get ready to complete the body map. And this will help us understand where you have pain and maybe why it hurts so bad. Oh, I made a mistake. I didn't mean to do that actually. So I'll click the red button on the bottom to reset it. And I have pretty bad head pain. So I'll put that here. If I want to view the back, I'll turn it to the back and also mark it there. Now it'll ask me a few follow-up questions, mostly around the eye. No, I don't have any of those. And then I'll say I'm ready to analyze my data. Okay, so eye sockets, bilateral. It tells me what kind of pain I have. I kind of reported what was going on for me in my context. And then it'll tell me the type of pain. There's a bunch of advice here about different types of conditions that may be related to your pain and things you might want to ask your doctor about. So you can have, if you click there, it'll show you questions to ask your doctor. And this allows you to have better communication with your doctor about your pain, so it can help them better understand what's going on for you so they can help you more, or vice versa. You might also feel like, because you're able to communicate better, that you feel more heard and seen by your care team. It'll also recommend some next steps, so things you can do immediately to make sure you're safe, or things you can try, and then changes you can do in your lifestyle to help with some of these symptoms that you're having, or I'm having here, let's say. One important thing is to note that it always says to track and monitor and to seek care if any of these other potentially emergency symptoms are happening. Now, I want to ask the Nerveli chat some more about my symptoms based on what I filled out. And so it records all of that here and sends it to our AI chatbot Nerveli, who's been trained in chronic pain. He tells me now, let me explain what might be happening. Sounds like I'm having some headaches and some eye strain, which all feels pretty accurate. I work at my computer a lot. I have a lot of eye strain and muscle tension. And it also recommends some things I can do. You can keep talking to Nerveli here if you have other questions, or maybe if you want to hear about some strategies. So you've clicked save, and now you can come to what we call the home screen. Here at the home screen, you'll see a lot of different things and places you can go. I first want to bring your attention to your pain management recovery journey. Current steps 0%, you'll click there. So we've curated very extensive education, content, tracking for you to do, and science in my research lab and many others have shown that just doing 5 to 10 minutes of these activities per day can help you manage your pain better for just 30 days. So 5 to 10 minutes each day for 30 days. So if you click start here, you'll see there are articles you can read. We can look at this one first. Welcome to Nerveli. They're meant to be simple, easy to understand. Once you finish them, you can click done. There you go. So you'll want to do 5 to 10 each day. At the bottom, you'll see you can also add personalized activities. So maybe one of your goals is to do a specific chore, to journal about your experience, or do some movement for 5 or 10 minutes a day. I want to add that to my daily log. So I'm going to add that here so I can keep track of it, and you can go back. So you'll progress through each of these chapters. They're meant to be quite quick, again, 5 to 10 minutes per day. For about 30 days, and you should start feeling a bit better thereafter. From there, I want to bring your attention to the daily log. So here you can report how you're feeling and get advice in the moment. So I haven't been feeling that well. My pain's been quite bad. My mood has been okay, but not great. That can happen when you're in a lot of pain. My stress has been quite high. I've been worrying a lot about my pain. I haven't been sleeping that well at night. I've done some walking, but not much. You can report your medications here. So I want to report that I took some Tylenol, and I took the 500 milligram tablet. I can add that here. I took 2 pills this morning, so I can put the time for that at 8 a.m. Can scroll up. And it helped with my pain. I'll save that in my daily log. You can also journal about your pain if you want to and save that all here. You'll see that you'll get some tips right away. Like pain like this can really drain your energy through reducing your activity. You can read through these different tips to help you. And this has been personalized to what I've reported. So because I reported bad sleep, it's giving me some techniques for stress and sleep as well. You can keep track of all of your data in this Your Data log. And if you click the This Week button, you can actually see progress charts throughout the month or the week, or even just today of what you've reported. This can help you kind of get a sense of how things are related. Like if your pain is really bad and so is your mood, how do those things relate together? We'll go back to the home screen. You can see there are recommended resources here. You can go through some mindfulness exercises and relaxation exercises that have been proven to help pain. And you can also share your story with your community. So maybe I want to share my daily log with how I've been feeling with my community here. Oops. And I can share my daily log. Last but certainly not least, you can come back to Nerveli to talk to him about what's been going on. So I'm having a rough day. I need advice. It can be anything, but remember, Nerveli's been trained specifically for chronic pain. So take the time and talk to him. He can help you figure out some of your day-to-day patterns you might want to change. He'll take in all the information from your log that you report as well. And any questions you have for your care team or your doctor can be stored here too. Back area that you can show us as well. If you want to go into the send feedback, you can send us feedback. You can complete your body map again. Let us know how things are going. We always want to make Nerveli better. Our goal here is to help people with chronic pain get back to their life. Chronic pain is complex, but relief